As the Traveller Health Unit Co-ordinator in Community Healthcare West covering Counties Galway, Mayo and Roscommon, I'm delighted to welcome you all to the launch of the multimedia resource. It's made up of 32 short video clips relating to the various stages of pregnancy. Over the next hour, we will take you on a journey to showcase some of the clips. We will also have some speakers. Senator Eileen Flynn will launch the resource, and Breda Crehan-Roach, Chief Officer, will provide the closing address. Both Siobhan Canny, Group Director of Midwifery, and Anne Pardy, Programme Lead at Nurture Programme, will also address us. The short video clips cover the early stages of pregnancy, labour and birth, followed by clips relating to postnatal period, including the early days of your baby's life, going home and meeting your public health nurse. It was of the utmost importance that we have the support of members of the traveller community, and I wish to express my sincere gratitude to the families who allowed us film in their homes. I wish to pay a special compliment to Mary Collins, Community Health Worker with Mayo Traveller Support Group, as Mary interviewed most of the healthcare professionals in a very relaxed and captivating manner. I wish to acknowledge the role played by the implementation team at Nurture for engaging with us and providing us with their materials very early on in our filming, so that our clips correspond largely with my pregnancy resource. We considered it timely to add a few additional clips. These are the Butler Test, caring for your teeth, both mum and babies, and the development of speech and language and reflections from a grandmother. Finally, I'm grateful to everyone, including Hunt Films, for undertaking the filming, the editors who worked with me painstakingly for many hours to ensure content accuracy and sequencing. Thanks to Jonathan at Bright Blue Solutions for his technical skills and coordinating today's presentation. Now to our first speaker, Vivian Fitzmaurice. She is the Primary Healthcare Coordinator at Mayo Traveller Support Group for many years, and she pioneered this piece of work together with Mary Collins, Community Health Worker with Mayo Traveller Support Group and others in the region. Vivian has a Master's in Health Promotion, and her particular area of interest is health literacy.
I'm going to say a few words about the background and context to producing these antenatal videos we are launching today. Studies over many years have highlighted the exceptional poor health status of travellers and the difficulties faced by travellers in accessing services. The Traveller Primary Healthcare Projects, or PHC, were set up over the past 25 years to address these and other issues affecting the lives of travellers. The PHC projects, as they've become known, provide vital health information to the traveller community through the work of the community health workers with support from primary healthcare coordinators. The primary healthcare projects in County Mayo, together with the maternity unit staff at Mayo University Hospital, established the Traveller Women's Health Working Group, with the purpose of addressing issues concerning maternal and infant health in collaboration with the traveller community. The poor uptake of antenatal and postnatal services amongst the traveller community quickly emerged as the #1 priority to be dealt with. We developed the idea of culturally appropriate short video clips covering each area of pregnancy and the baby's first 6 weeks. Along with our colleagues across the Western Regional Traveller Health Network, Roscommon, Tuam and Galway Primary Healthcare Projects, we established a working group to find out more about why this was the case and what travellers wanted. This included focus groups with women and men from the traveller community of various age groups to seek their views. Later, a facilitated workshop was held with project staff and healthcare professionals to map out the next phase of the journey. Through consultation with travellers, we learned that some of them experienced feelings of not being welcome in the health services and feelings of shame and embarrassment. We also learned from service providers that previous efforts to improve the situation had not worked. Literacy issues also acted as a barrier, and this combined with the lack of relevant, culturally appropriate health literature and the big words or language used by healthcare professionals could also act as a deterrent for attendees at services. From this consultation process, key priorities for the project included ensuring that the traveller voice is kept central to the project, that the traveller culture is respected, that the videos meet the needs of traveller parents, and that the messaging is kept simple, accessible and easy to understand. So why short video clips? They meet the needs in a number of ways. They can be easily distributed. They offer privacy so people can watch them in private at their own convenience. They facilitate people receiving information at their own pace. They can return to the information where they find it necessary or useful. It's visual and conversational, therefore addressing any literacy issues. It can be culturally appropriate, developed by travellers for travellers, and they can act as a support to mainstream services. I would like to take this opportunity to thank my colleagues from primary healthcare projects across the West and all of the healthcare professionals for the huge amount of support and commitment they gave to the project. Thank you.
I'm happy to introduce you to Kathleen Ward, who is Community Health Worker with Western Traveller Intercultural Development, Tuam, County Galway for many years. Kathleen is highly diligent, experienced and an intuitive community health worker. She has been working in community development for many years, even before she trained as a community health worker, and is a great community advocate. She sits on the Traveller Midwifery and Gynae Working Group at Galway University Hospital. She is a member of the Community Health Workers Forum. Kathleen was a wonderful daughter to both of her parents who are now deceased. She is a mother and a grandmother. Kathleen has been extremely supportive of the development of this pregnancy resource, and I want to express my sincere gratitude to her.
Speaking as a community health worker, I would like to say a few words about the importance of this resource from a traveller point of view and how it can help overcome some of the barriers we experience when attending maternity services both in the community and in the hospital. The pregnancy resource has been developed and created with the traveller community, for the traveller community. It will immediately help members of my community to identify with it. As it's visual and is done in the form of a conversation, I feel it would be of great benefit. I also know from my work with the traveller community that it would also be very beneficial in helping to address the literacy difficulties some of us may have, especially with the big words that is sometimes used by staff or in the leaflets that are given out. I also know it will help healthcare staff understand the difficulties we face when attending for services, and as a result of this piece of work, we can work better together in understanding and addressing these difficulties.
We are now going to view the welcome and introduction clip to the pregnancy resource, including how the Community Health Workers Forum in the West chose the name for the pregnancy resource.
I would like to welcome you all to these videos that would help you through your pregnancy and your first 6 weeks of a baby's life. I would like to thank the funders of this piece of work, the Nursing and Midwifery Planning and Development Unit covering the HSE West, and the HSE National Social Inclusion Office, as without them we could not have done this. The information for all the topics covered is contained in My Pregnancy. This book is now given to all parents-to-be. There is also a website, My Child, which you can view. We wish to thank Nurture for their support with providing us with this material. The videos will provide you with information on different topics, including when you first find out you are pregnant, keeping well in pregnancy, your entitlements and supports, your visit to the antenatal clinic, meeting the midwife, bonding with your baby in pregnancy and beyond, looking after your teeth in pregnancy and your baby's teeth, labour and the birth of your baby, health test including Butler Test, feeding your baby and going home with your baby. In your pregnancy you are likely to meet some of the following staff that will be caring for you in your pregnancy. These will include your family doctor, the midwife, the practice nurse, obstetrician, that is the consultant who will care for you during your pregnancy, though you may not need same. A specially trained midwife who will help you with breastfeeding, a public health nurse, physiotherapist if you're having problems with your back, bowels or bladder, social work if you require assistance with financial or other matters, paediatricians, these are doctors who are specialised training to look after the newborn babies if required, same. Dietitian if you need to have a particular or special diet. We hope that you find this information helpful, and if you need more information you can follow the links to other important websites. For more information and advice, go to the mychild.ie website. The Community Health Worker Forum from counties Galway, Mayo and Roscommon chose the name Beoir for their antenatal resource. This means mother, father and child, as we felt this information is about family as much as mother and child.
I trust that the clips you have just viewed will give you some sense of what to expect in the 30 clips we have developed. In the course of the development of these clips, we work with many healthcare professionals at our maternity units, and you will meet a representative of most of them on the clips. I have asked Siobhan Kenny, who is the Group Director of Midwifery at the Saolta Hospital Group, to address us. She has 5 maternity units within her brief. We worked with staff at 3 of them, namely Mayo, Portiuncula and Galway University Hospitals. Thanks, Siobhan, to you and all your colleagues for your ongoing support and work with us.
Hello, my name is Siobhan Kenny and I am the Saolta Hospital Group Director of Midwifery. I would like to extend my congratulations to Mary Siren and the coordinating team from the Traveller Health Unit in Community Healthcare West, who have developed this multimedia resource on pregnancy for the traveller community. In recent years, we have been working hard to listen to what women want from our maternity services. What you have told us through the Maternity Patient Survey and our traveller forums is that you want more information around caring for yourselves and your family in pregnancy and into motherhood. This multimedia resource is part of our response to what you have told us is important to you. Thank you.
We will now view 5 clips relating to early to late pregnancy, starting with advice to get you through pregnancy, to what to expect from your GP during pregnancy. A midwife speaks with us about smoking and caffeine intake during pregnancy. The next clip examines diabetes in pregnancy, which is becoming ever more common. The final clip relates to the key role played by the pregnancy support counsellor at the maternity unit.
I know that expectant mothers has to attend some appointments. What involved? What do those appointments involve?
Yeah, so the first appointment is probably one where the GP has sent the mother up to the hospital for the pregnancy. And that is the first appointment where they're going to meet really the midwives for the first time. They'll have maybe a history appointment where they'll be asked about have they got a history, medical history and history of having babies, and generally how their health is. And then they'll also maybe have the very first scan. From there on then they may not need to be seen for maybe another month or 2, and then it becomes more regular the more pregnant they are. So from about 28 weeks maybe they need to be seen every 2 weeks, and from 36 weeks in pregnancy every week. And every time they get seen, they usually have their blood pressure checked, their urine checked, their well-being and the baby's well-being.
Can you tell me when first expectant mothers get their scans?
So the
How
first,
many weeks are they?
yeah, that's a good question. The first scan we try and do is between 12 and 14 weeks. And ideally around the 12-week mark. And all they're really doing in that scan is checking, is there a pregnancy that looks that it's viable? Does it measure right? And is there a heartbeat? So is the mum pregnant? And can we see a heartbeat? And we're happy then. So we would always then recommend a further scan for a little bit later on, maybe about the 19 to 22 weeks. And we're checking other things then in that scan.
Thanks very much, Francis. I enjoyed that chat. Is there any key messages you'd like to get out there through this recording? Or maybe as myself as a community health worker?
Yeah, so I mean it's lovely to meet you, Mary, and I think the role you play is vital for these mums.
Thanks very much, Francis.
I think if they can be as informed as they can about pregnancy is really useful, because there's a lot of fear and anxiety for mums, especially first time mums when they come in. So we want to get them to come in positive and relaxed. The more relaxed they are, the better it is for them and their baby. So, not to be afraid to come to classes, get more education and attend their appointments, and then if they've any worries at those appointments to ask the questions.
You would be able to come to your GP for 7 visits during your first pregnancy and 6 visits if it's second or third pregnancy. Sometime after about 14 weeks, your doctor will start listening for the baby's heartbeat.
So if you find that you're getting a craving during the day and it's coming up to maybe a time that you go outside and have a cigarette, and you know that that's the time that you really would want one, then you could go and maybe take a little bit of gum, and that can help with the craving also. So that helps kind of when you really, really need it during the day.
So diabetes in pregnancy is very common. At the moment, every 1 in 6 pregnancies are affected by diabetes. The majority of those pregnancies are where women get gestational diabetes. You've heard of that word, Mary?
I have, yeah.
Okay, women with gestational diabetes start pregnancy having normal sugars, and then they develop the diabetes problem at about 24 weeks of the pregnancy. That's why we offer a test to the majority of women nowadays around 24 weeks to see if they have this diagnosis. Diabetes is at least twice as common in members of the travelling community than in people of the settled community. And obesity is about 4 times more common in the traveller community than in the settled community. So when traveller women become pregnant, they're almost guaranteed to develop diabetes in pregnancy. And therefore it's really, really important that they always ask for the glucose tolerance test, which is the test to diagnose diabetes, and that'll be given to them at 24 weeks.
What sort of help would you offer to the women out there?
What we provide is, I suppose, practical and emotional support around a lot of different issues that come up for women. And for every woman and for every family, it's very, very different, because what one family might identify as a crisis or as a problem, another family mightn't, because everybody's very individual and everybody has different coping skills. But in general, the areas that we provide support around are maybe around unplanned pregnancy or teenage pregnancy, when there's domestic violence or sexual abuse, when there are issues, relationship issues, sometimes, I suppose, bereavement counselling when a pregnancy goes into difficulty, or if there are alcohol or drug issues as well in a pregnancy. So there's a lot of different areas that we provide support around.
The next 3 clips we chose for you to view relate to labour and birth. They include exercises and positions to help labour, followed by pain relief options, and finally pregnancy and your mental health.
So usually when the baby is born, the mammy and the baby stay together and we do skin to skin. So here's our little baby here, all right? So what we do is once that placenta is ready for delivery, that baby can crawl up onto the mammy's tummy and we do skin to skin as much as we can. Is that all right?
Yeah.
So it's only the babies that have difficulty breathing that actually need to come over to the resuscitator. This is your own chair and you can use this whatever way you like, but it's fantastic if you get a little bit of pethidine and you can sit down here and just chill out and relax. Listen to your nice music in the background. So labour comes in 3 stages. It's the first stage, the second stage and the third stage, okay? And the first stage of labour is 3 centimetres considered established labour, so 3 centimetres to 10 centimetres. Then the second part of labour is the delivery of the baby, okay? So how the baby actually comes down into this world. And then the third part is the delivery of the placenta. The blood, once the baby's delivered, we let the blood over to the baby, okay? And there's a pulse on the cord, and we can actually feel it. So once that cord stops pulsating, or we think that the baby is crying enough, so say 2 to 3 minutes after the baby is delivered, then we can actually clamp the cord and you or your partner can actually cut the cord. And once that cord is cut, then that baby is yours forever and is in this world breathing on his own. So the more you can go on in labour without any kind of intervention or any kind of pain relief, the better. Having said that, if you need pain relief, it's there for you. So
is it quite normal for every mother to feel baby blues?
Absolutely it is.
It's just when it continues, you'll be reaching for
when it
help.
goes to an extended period of time, that's when you need to be concerned.
Moving on to our next speaker. I want to acknowledge that many of you already have a working relationship with the Child Health Programme Development Officer in your area. These roles began as part of the Nurture Programme, which is led nationally in the HSE by Anne Pardy as its programme lead. Another aspect of the Nurture Programme is the development of the My Child website and the My Pregnancy and My Child books. Anne and her colleagues are also supporting the Sláinte Care Child Health Project. Anne herself comes from a speech and language background, so I will now ask Anne to address us.
I'm delighted to take part in the launch of the Pregnancy Multimedia Resources for Travellers. This is such a great body of work, covering so many topics that are important to parents as they progress from pregnancy through to early childhood.
I know what a significant achievement it is to create this extensive suite of resources, and it's great to see so many experts from hospital and community taking part. We know from our research with parents that while they greatly value the direct support and advice they receive from health professionals, there's a growing demand for online resources. These resources will meet a real need in this area. The question and answer format makes the information very accessible, and they have, of course, the benefit of being available 24 hours a day, 7 days a week. I believe they provide great clarity and reassurance and will be of benefit to parents across Ireland, both within and beyond the travelling community. I would like to warmly congratulate Mary and all of the members of her team for this valuable work. In particular, the members of the travelling community who had the vision to see the value of these resources and contribute to their development.
The last set of 4 clips relate to what to expect after your baby is born and the baby's first few weeks. The first clip looks at the role of the public health nurse, and this is followed by information on the Butler Test. Next, we look at building a relationship with your baby, and finally we explore how to help your baby to talk.
If there is a history of galactosemia, or if a child is born and they're known to be from the traveller community, we can do an earlier test, specifically called the Butler Test. And it's a very similar test to the heel prick test. They have the test carried out in the same way, and it's a number of little drops of blood onto the card, and this goes to the laboratory in Dublin.
The role of the public health nurse is to support you and your partner in caring for your new baby. The public health nurse also supports and cares for the new mother as she recovers from giving birth.
Building a healthy relationship with your baby is about trying to figure out what your baby's cries and signals are trying to tell you. For example, are they trying to tell you that they are hungry, they're tired, or they want to cuddle? By you trying to figure out, in other words, tuning into what your baby is needing and wanting, you will be better able to respond to their needs. And when you do in a gentle way, the more your baby will feel loved and secure. Newborn babies are not able to learn routines. Responding to their needs is what helps them to settle. In the same way, babies cannot control their feelings. They need you to help them to do so. And that is why the more responsive you are to their feelings and needs, the more this helps your baby's brain to grow.
How does your baby learn how to talk? It's interesting to know that during pregnancy, babies in the womb can learn to recognise voices and sound, especially their parents' voices, and so they recognise these voices easily when they are born. Laying down good foundations so that your child can speak or talk clearly and learn language is very important during pregnancy and when your child is born. Finally, a word on weaning. Babies take fluids only through breastfeeding or bottle feeding until they are about 6 months of age. It is important not to introduce solids earlier than this time, as babies are not yet able to manage food. Starting your baby on solids at 6 months is vital in order to help your baby to develop feeding skills, which will also help speech development. It is also important to introduce cup drinking from 6 months of age, as this will also help your baby to develop their feeding and speech skills.
We're now coming up to the launch of the pregnancy resource, and I'm going to introduce you to Senator Eileen Flynn. Senator Flynn was nominated by the Taoiseach Micheál Martin in 2020 to the Seanad, and she is the first traveller Minceir to serve in the Houses of the Oireachtas. Her background is in community development and activism on behalf of travellers and in solidarity with other ethnic minority communities. She is also deeply committed to women's rights, human rights and equality. Eileen has worked with a number of organisations, including the Irish Network Against Racism, Ballyfermot Traveller Action Group and the National Traveller Women's Forum. She was one of the first people in her family, along with her twin sister, to attend university and graduated with an honours degree in community work from NUI Maynooth. Originally from Ballyfermot in Dublin, she now lives in Donegal with her husband Liam and young daughter. She hopes to use her time in the Seanad to lend her voice to the cause of human rights and equality for all those who are marginalised in Irish society.
My name is Eileen Flynn. 18 months ago I had a beautiful little girl, Billy. It was a beautiful result from an absolutely horrifying pregnancy. I had minor health issues along with Billy. I also experienced really bad postnatal depression during my pregnancy and after my pregnancy. And today it gives me great pleasure to launch the Traveller multimedia resource pregnancy, and the multimedia resource pregnancies with Traveller Health Unit with Galway, Mayo and Roscommon. So today it gives me great pleasure to launch this programme. Most importantly, 18 months ago, when I was pregnant with my girl Billy, I would have loved to be able to get relative information, get right information from the HSC to have the programme that's available for Traveller women today. It's not just available in the West, it will be available all over Ireland online. A brilliant service, a brilliant resource for all women to look up, and for men as well. Let's not forget, pregnancy can be very tough. While it's tough for women when we're going through, but it's also very new and very tough for men as well. Also for new fathers. So this programme supports women and fathers, and it also gives us right, accurate information from the HSC. So I am absolutely delighted that there's a safety net there for Traveller women who are pregnant, where they can find good, reliable information. So again, without any further ado, I would like to launch the multimedia resource pregnancy, and it's not only for Traveller women. This programme can be for all women, and especially for marginalised women and women from ethnic minority groups. I would encourage women and men to get involved.
We are now moving to the closing address, which is going to be provided to us today by Breda Crehan-Roach, who is the Chief Officer of Community Healthcare West, a post Breda took up in January 2020. Prior to that, Breda was the Chief Executive Officer of Ability West, a Section 39 funded organisation providing services to adults with intellectual disability throughout Galway City and County. Over the years, Breda held a number of senior management positions. She is a registered nurse and Montessori teacher. She has an MSc in Economics and Healthcare Management from the University of Wales and an MBS from the University of Limerick. From 2015 to 2017, Breda was chairperson of the National Federation of Voluntary Bodies.
Hello, I'm Breda Crehan-Roach, and as Chief Officer of Community Healthcare West, I'm delighted to have the opportunity to take part in this multimedia resource. At the outset, I wish to acknowledge the work of the Traveller Health Unit in Community Healthcare West, who have been working very hard over 20 years. During this time, we have worked in partnership with the Traveller organisations and with other services in seeking to find ways to address and access to healthcare services so that they are culturally appropriate and are both accessible and acceptable to members of the Traveller community. I would like also to acknowledge Senator Flynn, who plays a key role at national level in bringing attention to the issues that travellers face on a daily basis. I wish to congratulate Senator Flynn on her new role, which is a very powerful one and will have a very positive impact and influence on national policy development. As Vivian said earlier, it was members of the Traveller community who came up with the idea of delivering the education messages in relation to pregnancy using audiovisual resources. This ensures that people have access to this educational resource at a time and a place suitable to them, using their smartphones, computers, laptops, and they can also review the material again and again if they so wish. I would like to compliment you all on this excellent piece of work. The Traveller Health Unit and structures that we have in Community Healthcare West have really helped to drive this resource and many other worthwhile initiatives, such as our 4 Traveller Health projects, which employ 39 members of the Traveller community as peer-led community healthcare workers, 37 of whom are female and 2 male. I particularly want to thank the Traveller project staff and members of the Traveller community who have set very high standards in developing wraparound services to your community since the start of the COVID-19 pandemic. It was an excellent model of service provision, and I am aware from speaking with colleagues across Community Healthcare West what a great support this has been to us in the HSE over the last 12 months. The active participation of the Traveller community is welcomed at all levels of our health services, and I particularly want to compliment you who have led the way, thereby ensuring that the voice of the Traveller community is heard. It is particularly evident throughout the short video clips relating to pregnancy, and I want also to particularly thank members of the Traveller community who participated in these videos and also for inviting us into your homes during the making of the video programmes. I want to thank you all and to acknowledge the support you have provided to the HSE staff. Together, we have worked in partnership and provided network opportunities over the past number of years. It is well recognised that without your support, the HSE would not have direct access, as we do now daily, to the Traveller community, which is very unlike the past when this was not the case. This development complements many of our HSE key strategies and policies, and in particular, Healthy Ireland, Healthy Childhood programmes, and National Maternity Strategy, as mentioned by other speakers previously. I would also like to acknowledge the support we have received from our 2 main funders, the HSE National Social Inclusion Office and Nursing and Midwifery Planning and Development Unit, HSE West Midwest. In due course, I look forward to receiving feedback about how the resource has been received by the Traveller community. Finally, I would like to wish you my very best wishes and also wish you continued success. Stay safe and well. Thank you.
We have now come to the end of our journey in the launch of the Pregnancy Multimedia Resource. I wish to thank all of you who took the time to join us this past hour. I want to extend a special word of thanks to all those who I have worked with over the past number of months and years in getting this finalised, even in the time of COVID-19. I wish to thank all of the speakers for taking the time to work with us in preparation for today. We will work with you in the weeks ahead to ensure that all members of the Traveller community can access the 30 short video clips. We have provided you with an email address for Olive Gallagher if you wish to make contact with us. Thank you all for your support.